Now we'll be talking about Sacubitril Valsartan combination. Now this is one of the excellent drug which is out there for heart failure. In fact, if someone has heart failure with reduced ejection fraction, if someone has EF ejection fraction of less than 40%, and if we need to start a single drug, that would be Sacubitril Valsartan. It is one of compared to a newer drug. There are so many brands available, like Neptaz is there, Sidmus is there, Arnipin is there, Mymarda is there. There are so many brands which have this combination. Very commonly, this drug is initiated at it can be initiated at the dose of 25 milligram twice a day as well, or it can be increased up to 300 milligram per day as well. Initiation of the drug is always tricky because most of the time those patients who have heart failure with reduced ejection fraction, if the patient has good systolic blood pressure, if the patient is not on any inotropes or vasopressors, then only this drug should be initiated. If the patient is on, suppose, noradrenaline, dopamine, dobutamine, or vasopressin, this drug should not be initiated. Patient's systolic blood pressure must be at least more than 100 millimeters of mercury. If the patient's blood pressure EF ejection fraction is very less, suppose if it is like 15%, 20%, then this 100 systolic blood pressure may not be achieved. So even at up to 95 millimeters of mercury also, sacubitril valsartan combination at the dosage of 25 milligram twice a day, which you can simply half the tablet of 50 milligram, and you can give that tablet twice a day. One of the most important thing before starting sacubitril valsartan is always to look for creatinine, is always to look for potassium, because very commonly after starting sacubitril valsartan, many of the patients do have low blood pressure, so the blood pressure can fall and the creatinine can rise. So if there is persistent rise of creatinine, or if there is persistent rise of serum potassium, then that can be detrimental, and in that circumstances the dosage of the sacubitril valsartan can be reduced and can be continued at a lower dosage, so that serum creatinine and serum potassium also remains at a stable level. Potassium should always be less than 5.5 only before initiation, and after starting sacubitril valsartan, the potassium should remain lower to 5.5 only. There should not be rise to more than 25% of the serum creatinine. Even if it rises, it should stay to a stable level. It should not continuously keep on rising to more than 25% of the baseline after starting this sacubitril valsartan medicine. So it should be always started when there is stable blood pressure, and if the patient is not on any inotropic or vasopressor support. The blood pressure of more than at least 100 millimeters of mercury should be there, and it should be increased over a period of few days to few weeks. It can be increased every seventh day after checking the blood pressure, and it has shown excellent effects in reducing cardiac related morbidity, cardiac related mortality. It has significantly reduced rate of hospitalization due to heart failure. So this is one of the most important pillar of heart failure with reduced ejection fraction. And if there is one medicine that we should consider starting in a patient with reduced ejection fraction, that must should be always a sacubitril valsartan combination, because it markedly improves the quality of life. The capacity with which the patient's physical exercise doing capability markedly improves, markedly increases. It markedly reduces the hospitalization. Otherwise, earlier the patient used to get admitted for so many times, every month, every 2 months, every 3 months, because of the heart failure. But because of this drug availability, this hospitalization because of the heart failure has markedly gone down. Earlier, the patient used to die because of arrhythmias, because of the recurrent heart attacks. That has markedly gone down because of presence of this sacubitril valsartan drug. And it has shown excellent effects in reducing the remodeling the heart. So that is the reason sacubitril valsartan, it should be always initiated. If the blood pressure is low, it can be initiated at 25 milligram twice a day. If blood pressure is very good, like more than 120, 130, it can be straight away started at 50 milligram twice a day. and it can be escalated to up to 300 milligram per day very, very easily. Thank you.